All right, I said this a whole lot of times already, but one of the most important things, don't smoke. And we're talking about nicotine and tobacco here for at least 6 weeks after surgery. Ideally, you wouldn't start or restart smoking in the first place, but if you're going to, please wait as long as possible to give your body the very best chance of healing that's possible for your body. And this is just to repeat what we already said, nicotine constricts our blood vessels, and that makes it challenging for the body to get the nutrients that it needs to heal. And so it may not heal correctly, or it may take a very long time to heal, or you may have more complications from smoking. Wound care. This is going to be very individual, depending on which surgery that you had, but it's really important that you and your caregiver have a good understanding of how to take care of your surgical wounds. You may be instructed to keep all bandages dry and in place and not shower for a certain amount of time. It's really important that you follow that instructions. The surgeons want everything to look as good as possible, so that's why they give you the instructions that they give you. Bring some baby wipes so your caregiver can use those to help you get clean before you're allowed to shower, and they can wash your hair for you. In a lot of cases, you're going to need help washing your hair, so make sure that the caregiver can do that for you. For chest and face type surgeries, you should still be able to wipe yourself, so that's important for a lot of people, so just know that. For those who are allowed to shower, make sure that your caregiver helps to wrap the parts that you need to keep dry with saran wrap if you need to keep things dry. And for chest and or breast surgery, stand or sit on the side of the bathtub, have your caregiver wash you. Face, breast, chest surgery, you can wash your own genitals and buttocks. Oh, talked about this again. You can be able to wipe yourself. However, if you're having genital surgery, you may need your caregiver to take care of the wound care in your genital region. It'll be so important that that's somebody that you trust and are okay with seeing and touching those parts of your body and cleaning you. So very important to have lots of conversations about that to make sure that everybody involved feels comfortable with what you're going to need. Drains and wound vacs. I would talk to your surgeon and ask the question, am I going to have drains? Is there going to be a wound vac? These are more common for genital surgeries, but many people who have breast augmentation or mastectomy or breast removal may have drains. And so if you have drains or a wound vac, there are a lot of good care instructions that you can find online on different websites. Most surgical drains, or they call them JP drains, Jackson Pratt, probably the person who created it. You can look it up online. A lot of those are for people who had breast cancer and had a mastectomy, and they have videos about drains and how to take care of drains. That's still, even if it's for a different purpose, still helpful to know how to use or how to take care of drains. And surgeons will usually take those out about a week after surgery, depending on how well it's draining. And your caregiver should be instructed on how to keep track of how much is coming out of the drains, what color, and if there's two or more than one, they should keep track separately, like if one's on the right, one's on the left or whatnot, of how much, what color, how often that they're having to empty it, etc. And the hope is that there'll be less and less fluid that comes out of them over time, and that helps the surgeons know when it's time to take them out. For wound vacs, if you have a graft or if you get like RFF type of phalloplasty or any sort of phalloplasty that they use a graft or they use their skin, they may apply a wound vac to that area. That's usually done in the hospital and usually managed in the hospital. But if you have to get sent home with a wound vac, make sure your caregiver and you understand what the instructions are, how to know if it's not working anymore, because these things can stop working and you need to go to where do I go? Do I show up in the emergency room? Do I show up at the hospital? Like, where do I show up if the wound vac isn't working? There are multiple types, and depending on which type you have, there should be some instructions online. Your surgeon's office should be the ones to give you the instructions, but if there's kind of things you want to do in advance to prepare by learning about wound vacs, you should do that. All right, let's get to some specifics. So after mastectomy, and in some cases this involves breast augmentation as well, similar. Surgeons will want you to use your arms for as little as possible for a certain number of weeks, and they should specify that with you. So I always say, be like the T-Rex, whose arms are like worthless. They're just there for decoration, right? They don't really do anything. So that's can be hard for some folks who are just used to like reaching out and grabbing something whenever they need it. And so you have to remember that you got T-Rex arms for a little while, and caregiver will be important for you to remind them if you see that they're forgetting. Also, mastectomy scars for many people are really large and across the chest. Facial scars may be smaller, breast dog, it all depends. But if you have kind of these large scars across yourself and you want to go outside without a shirt on, it's important to realize that UV rays, specifically UVB rays, actually can break apart scars at the molecular level that are trying to form. So we really don't want the sun to hit the surgery scars, even with sunscreen on for at least a year, because that can delay healing and sometimes make the scars even larger. So I would make sure, if you're going to go outside, there are some products you can buy that actually block UV rays specifically. So I would make sure everything is covered. If you want to be the safest possible, no sun hitting the surgery scars, no matter where your scars are, for at least a year, so that you can protect your body and healing. Sleep on the back with the head elevated using 3 to 4 pillows. This may or may not be recommended for breast augmentation as well. So check with the surgeon. They will tell you how many number of weeks. Do this for X number of weeks. So follow your instructions from your surgeon. Why do I have to do this? A lot of people are like, I'm a stomach sleeper. I really don't want to do this. Well, it helps reduce swelling and pain. And it also makes sure that you're less likely to roll over on your surgical sites. So, gravity, etc. You want to help kind of things keep flowing around the body, etc. So your immune lymph fluids, your blood circulation as well. You want to help kind of everything keep moving. If you're laying down flat, it's more likely all the fluids to go directly to where you had surgery, and that can have implications for swelling and pain as well. So if they instruct you to do this, really important that you do it. And make sure if you're staying in an Airbnb or a hotel, make sure that you have some extra pillows to be able to do this. Swelling, bruising, and pain are going to be variable in how intense they are for each individual, and there may not be the same in each side. So it's really important that you keep compression on the chest area for, this is an example, 4 to 6 weeks, but however long your surgeon tells you to do that for. This can be particularly annoying for folks who have been binding their chest for a very long time. They finally get chest surgery and it's like, oh gosh, I have to bind again. Yes, you really do. It's really important to minimize swelling. Some common complications are what's called a seroma or a hematoma. Seroma is fluid. It's usually straw colored or kind of clear in color that can build up in the area. And a hematoma is the same idea, with blood that builds up in the area. You may actually have to go back in for surgery or have a small procedure where they take a needle and they remove the swelling material that has built up in your body. So the best two ways to prevent that are using the compression vest as they prescribe, as often as they prescribe it for you, and also taking it easy. If you try to overdo it too fast, you're more likely to have one of these complications. Ask your team how to wash and dry the compression binder or vest that they give you. They should give you one that's specific for post-op after surgery that usually kind of ties some in the front, because you're not going to be able to pull it on over you. These are usually washed on delicate and dried on a low setting, depending on the material. If you're getting like really gross and sweaty, asking if they can give you two or asking how you can wash them will be very helpful for you, especially if you have to wear it for 6 weeks, got to be washing it occasionally. Nipple grafts. So if you get nipples during surgery, the dressings for the nipples are usually removed about a week after surgery, and that's similar for drains. So when I talked earlier about how prepare for at least 4 visits if you're having chest or face or breast surgery, usually that week after visit is when they pull the drains if you have drains, and also when they change the nipple dressings for the first time. And they'll teach the caregiver and you how to take care of them. So some people may say change them twice a day. They may want a specific ointment that you use, but make sure that you know exactly how they want you to do this. I would, ask if you can record while the nurse does it, just so you can have a video memory of how to change the dressings. And this applies to kind of any dressings. Just ask permission before you start taking videos. I think that's really important. And some of them might not allow videos, and they might have an example video online to refer you to, and that works as well.